Kenya was on a way backwards instead of forwards. And I think if I summarize what happened over the past 6 years, this has changed. And what the National Health Sector Strategic Plan number 2 was visioning, reversing the trend, it has appeared, it has come. We have seen impressive reduction of the mortality of infants and of children, almost by 50%. We have seen the country struggling and succeeding to increase the vaccination coverage, the preventive service, but also expand the curative services. I think Kenya has gone an impressive way. We have a sector-wide approach. We have established sector governance structures. The development partners, the government, the private sector, the non-for-profit organizations meet in a very organized way. We have meetings on strategic level, working groups. We have working groups on technical level. For example, if there is a new vaccine to be introduced in Kenya, this will be discussed between all the partners and there will be consensus reached before government takes major decisions. I think this is a lot of progress. Of course, there are also challenges. Not all donors, not all development partners, not the entire private sector, not all government bodies are yet united under this approach. But I'm very optimistic, given the strong leadership of the Kenyan government in the health sector and elsewhere, that this will come. Let me talk about contraceptive supplies through KfW, the German Development Bank. For many years has secured that hundreds of thousands of Kenyan women, millions of Kenyan women, had access to contraceptives and still do have. There are financing models like the output-based approach through KfW that are very successful examples on how to bring about health care for poor women and families. We have been advising government, we have supporting government, we have helped develop the capacity of government, but also of civil society, of faith-based organizations. And maybe to talk about a few highlights, I think the country has a clear vision where to go to bring healthcare to all people, to make it affordable, to have people not staying outside of hospitals and health centers because they don't have money to pay. And I think in establishing and helping establish Kenya a financing vision, financing strategies, I think GIZ has been a key partner of the government. Same is true for reproductive health, where we have significant support to the Department of Family Health, to the Division of Reproductive Health. Our government just has committed substantial funds. It's almost 850 million Kenya shillings to alleviate the drought in the northern regions of Kenya. And this is a continued expression of the support of the German people to their Kenyan fellow. So I think altogether German Development Cooperation has played an important role. We have not done this alone. There are many other development partners, many other organizations ranging from the World Bank, ranging from DFID, the French Corporation, the US government, very important contributions, and many other partners, the African Development Bank. And I think the success we had was a success of cooperating together with these partners and dividing the work into sizable portions so everyone did what he could do best. And I think this is a success story in Kenya. The cooperation between development partners is successful, but it needs of course, to be strengthened. We are not yet there. There are key partners that share values together with the Kenya government, like poverty orientation, like a focus on prevention, like making healthcare affordable to all people. There are other partners who are yet outside, who are not part of the Development Partners of Health Forum in Kenya. But I believe that over time they will be included. And as I said before, I'm very confident because the Kenya government is displaying a strong leadership. And I think in Kenya it is not the development partners who set the agenda, but it is government, and this is good.